Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, economic restart problems, but first, yes, there is a hesitancy to get the vaccine. As they say, let's get to it.
Welcome to the fast-paced and unrehearsed weekly discussion featuring the leaders who help shape your world. Join us as we address the issues that impact you each and every day. This is Pennsylvania Newsmakers. And now, here's your host, Terry Madonna.
Well, we couldn't have a better guest to talk about vaccines, the hesitancy to get it, who is impacted, fair access to vaccines. A really very important question, and that guest is sitting across from me. He's Dr. Michael DellaVecchia. He is the president of the Pennsylvania Medical Society. Doctor, welcome.
Thank you, Terry.
Well,
Happy to be here.
It's great to have you here. All right, we got a whole bunch of a number of important subjects to get to. Let's start out with the first. There is a hesitancy among a whole variety of Americans to get the vaccine for a variety of reasons. What are some of those reasons?
There are many reasons, as you alluded to. Some of them, unfortunately, may be related to their impression of what the vaccine does, both right or wrong, and a little fear to act upon it. There's still a question in some parts of the country of access, but that's very rare now. Mm-hmm. Some of the other questions have to do with religious interpretations of certain things.
They wouldn't get it.
Yeah, and other things have to do with social activity.
Yeah. But there are also some, if some folks have health-related concerns, they've had some serious health care problems. I don't need to, you're probably better at pointing those out. You got these health care problems, and they're worried if they get the vaccine, that will create a very serious problem for them, health problem.
Those incidents are actually medically very rare.
Oh, okay.
Okay, and yes, there is some validity to that. Certainly, if you had a reaction to a certain vaccine, say the yearly flu vaccine, you'd be very hesitant both to give it medically and to take it as a patient. But once again, the whole thing is risk versus benefits.
Right.
Okay, so even if there is a certain risk, a certain downside to a small element of the population, we're pretty convinced that overall, and the numbers prove this, the benefit of getting the vaccine far outweighs the risk. So it's versus a small chance of getting sick or probably even death versus a larger chance of getting very sick and dying from the COVID vaccine.
Right, that's a great point. I'll tell you something, there are a number of folks, and we kept hearing this earlier, like if you're 65 or over, there was really a lot of pressure, get the vaccine, get the vaccine. Not so much for younger people, and now they're moving, they've slowly moved the age down until now we're talking about, relatively young people have been told, go get the vaccine.
Correct. And that is from the data analysts that have performed the necessary calculations at the Center for Disease Control. In the beginning, when we were looking for vaccine access, we wanted to vaccinate the high-risk people. Right. We wanted to both on who would get the disease and have great mortality with it, and both the people who would be possibly spreading the disease, like the first-line workers. So the emphasis was on that. We knew that the elderly people had a lot of comorbidities. Right. So they had heart problems, they had lung problems, they may have been smokers for a number of years, they were diabetic, they were overweight. So for those people getting COVID, there was a high risk of mortality. Mm-hmm. So we inoculated them first, and as we have more and more access to the vaccine, we're expanding the number of people that should get the vaccine, and now it's being lowered into the younger people, who they're finding to some degree make out quite well when they're infected with the vaccine.
And they may be asymptomatic, is that
totally
correct?
Asymptomatic. Many people who get the infection are asymptomatic.
That's the scary part of it.
That's the scary part, because you can infect people and not know it. Yeah. And that's what they're trying to do with the younger people, who at this time of the year and at that age group are more out and more socializing, more visiting grandparents and so forth. So that's the area of concern.
All right, we're going to run to a break. I want to talk about fair access to the vaccine and a couple other related questions, and we'll do that after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Well, we're talking a lot about an important subject, vaccines, and we're getting into the nuances of it with Dr. Michael DellaVecchia. He is the president of the Pennsylvania Medical Society and on the show on a number of occasions. All right, doctor, I want to go to, I don't think there's any doubt, you'll tell me, that not everybody has the same access to the vaccine, and that has become something of a sticking point and even a political issue in our society.
That's what I understand, but at this point in time, Terry, actually, we're kind of looking for arms to put the vaccine into. Whereas if we had this conversation just 3 short months ago,
and we did.
It was the other way around. We were looking for more vaccines to give the people. The vaccine production has remarkably been very effective. And so there are some people in inner cities and certain elements of the state where through this program, which you do an excellent job, we want to get the word out to.
Absolutely.
The vaccine is available. Please come and take it. It's available to everyone with only minor restrictions, as we talked about earlier.
Correct me if I'm wrong. Supply has exceeded demand so much that some of the places that are doing the vaccines, like at shopping centers or whatever, where you can walk in, number one, originally you needed an appointment. Now you don't need an appointment. You can just walk in and get the shot. Number two, they're actually reducing the hours because the demand for it has dropped. I'm not saying there isn't demand, but relative to the supply, and even President Biden has said he's looking to ship the vaccine to other countries, obviously because supply versus demand. Does that make any sense at all?
That's correct, and it does make sense. It makes sense to the point that just a few short months ago, if you opened up a vial of vaccine, which had about maybe 10 vaccinations in it, you wanted to make sure you had 10 people readily available.
Right.
Okay, and you would call around and you would get the people, you'd get everybody together, and then you would open up that vial. Now we're told to open up that vial, even if you have one person to vaccinate, and then we'll get the other people in if necessary. And, you know, when you're talking about surplus, when you look at the World Health Organization numbers, there are approximately 1.5 billion people who've been vaccinated. You know, there's still pockets that are very concerned, like Africa, you know, the Mideast and the Far East. But, you know, in the United States, God bless us, you know, we're kind of ahead of the game. We're just waiting to get the last element of hesitancy away with. And once we get that, we'll feel a lot more secure.
You know, another aspect of it, it seems that, you know, there was all this discussion of variants that emerged, that were emerging, that could affect, you know, if you had a vaccine, it might not work with variants coming from different places. It now seems that the vaccines that we're taking cover them, meaning, you know, that the variants haven't had a big effect on people getting COVID if they got, you know, a vaccination. Pfizer, Moderna, J&J.
That's true. We fortunately find that there is a lot of overlap with the variants.
Right.
As we know, viruses are extremely clever. You know, COVID-19 was just a short 18 months or so ago away, and now they're detectable something like 13 variants, some of which are very virulent, such as the new one in India, which is accounting for some 10 to 13,000 deaths a day.
Wow.
You know, it's horrendous, but we're finding that there is some cross protection with the vaccinations that you mentioned.
Yeah. So before I let you go, I mean, maybe it's me, but I still, even though I've been vaccinated, wear a mask when I go into stores, even if you don't need one. I'm trying to be, maybe I'm just being unusually protective, but so, and I figure it doesn't do any harm.
Exactly. And that's a good way to look at it. Part of it is sociological, as I tell people, that's our little blinky or security blanket.
Yeah.
And of course, there's no harm for doing that.
Yeah, I mean that's a big point, and eventually this, what they refer to as herd immunity, looks like it will have to play a role when we get a much larger percentage of Americans who obtain the vaccine.
That'd be a good thing for the overall population, and it's something we were talking about earlier. People our age remember the polio devastation. And we waited to vaccinate enough people that essentially there are no polio cases really prevalent nowadays throughout the world.
Yeah.
But, we remember what an effort that was with Jonas Salk and Sabin back in the days. And there were hard pictures of children in iron lungs the rest of their life.
Oh my gosh, yeah. Well, look, I want to thank you for coming in. Great update. All right, coming up, we're going to talk about the economic restart problems and how important they are to all of us for a variety of reasons after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Cross-State Credit Union Association. Credit unions, where people are worth more than money. To find a credit union that is right for you, go to ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is brought to you by the Association of Pennsylvania State College and University Faculties, representing the faculty and coaches who are devoted to providing quality public higher education for Pennsylvania's college students.
Well, another extremely important topic, getting the economy of the nation and, of course, of Pennsylvania, I'll put it this way, restarted. I couldn't have a better guest to talk about that than Gene Barr. He's the president and CEO of the Pennsylvania Chamber of Business and Industry. Well, Mr. Barr, I'll tell you, I can't go, I'll put it this way. I can't go anywhere in Lancaster where I live where there are stores, whether we're talking about restaurants or salons or bars or whatever, even larger ones, help wanted all over.
It's not just Lancaster. It's
yeah,
not
I know,
just
but I'm saying I
Pennsylvania.
see that every
It's
day.
nationally.
Yeah.
And it's restaurants, it's bars, but it's also trucking firms, it's manufacturing, where manufacturers are saying, I've got to end this second shift because I don't have the people. And you've seen it, as you know, everywhere. There's help wanted signs everywhere. It's approaching a crisis among the business community. And we can talk a lot about why that is. I will tell you, despite what some people say, we truly believe this extra $300 is making a big difference that they get from the federal government in terms of an add-on to unemployment. Right now, roughly 1 out of every 4, I've seen some other surveys that show it's more, but 1 out of every 4 employees who are unemployed makes more unemployed than employed. So it's a huge disincentive to go back to work. And the folks who are saying, oh no, we need to keep it, are saying things such as, well, you have to pay them more. Well, last month, wages rose at an annualized rate of 8%. And of course, the other side is the fair question, should business have to compete with the federal government to fund their employees? 44% of small businesses in a survey in March said this is the worst hiring that they've had in decades. Which shouldn't be when you look at the unemployment numbers. Others have said child care is an issue, which might be the case, but a recent study, when I say recent, this week came out, which was headed up by President Obama's former chair of the Council of Economic Advisors. It said child care issues are a negligible part of this. So when you cut everything out, the fact that the federal government is subsidizing people, unfortunately in many cases, to stay home is causing a big piece of this crisis.
Is that going to continue?
Well, it goes until September. But 22 states have already said we're ending it. Granted, they're all Republican governors. the state of Connecticut, which is a Democrat governor, has instituted a return to work bonus but has not ended the $300. We think this needs to be revisited at this point. We're all for safety nets. You've got to have safety nets. But when you incent people not to work, it creates problems not just for business, but we're going to see problems in supply chain. You're going to see problems. Restaurants have had to close for lunch, shut down hours, restrict menus. Truckers are having a hard time, trucking companies, which means the products don't get out. Consumers are going to begin to see this issue. We're already seeing it in terms of some of the highest unemployment, the highest inflation rates that we've seen in years. So that's coming.
Look, you're the business fellow. You follow this carefully. If we were to talk about I'm going to put you in the prediction business. If you and I will talk about this next year. We'll get that straight right now.
No problem.
What would you likely say
about
the economy and how it's functioning?
I mean, what I'm hoping is.
Are you optimistic?
Yeah, I'm optimistic. Let me put it this way: optimistic short term. Let me put it that way, because I think we will get there only because we've gone into such a trough. I think we've got to resolve this 300. We have to get people back to work. My concern is some of the decisions and some of the bills that are moving at the federal level, including higher tax rates, including more mandates, have certainly the potential to disrupt the economy long term.
All right, we're going to run to a break. There are a couple of other topics that I want to get into. I think let's talk about the election results and the significance that has, particularly for the business community, and we'll do that after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine.
All right, Gene Barr, before we get to election results, I have a follow-up question that deals with the large number of people who are working at home. And it looks like, that obviously people are going to come back, but a fair number of people are going to continue to work regularly at home. I'm not saying they won't go back into the office, but routinely they'll be doing their work remotely at home.
There's going to be a continuation of remote work. A lot of employers want their people back in. They're afraid that they lose this spontaneity. Rather than walk and talk to somebody, I got to schedule a Zoom call or a conference call. Probably not as many 100%, but as you note, there'll be a lot of remote working. But there's a downside in addition to that, what many people call the loss of spontaneity. Many people have been burdened by this lack of separation. Where does your home life end and your work life end if you're working from home? And a lot of people have not been pleased about that. A lot of people do like it. The other thing when we think about that, when you look at a downtown, whether it's a Lancaster or Harrisburg or Philadelphia, with fewer people, potentially we need, unfortunately, fewer restaurants, fewer gift shops, fewer other services. So what will those cities look like as this pandemic ends fully, keep our fingers crossed, and we begin to see what work looks like, particularly what workplaces look like into the future?
That's a great point, and it's one that's not been made. Most of it has to do with the work-related aspect of it, not what it would do to the society and the economy as a whole.
Exactly right.
All right, well, let's talk about election results. We had a primary election that drew a lot more voters in past primaries. It looks like it's going to push about up to 30% of registered voters. Typically, it'd be about 20%.
20, yeah.
And so that's pretty profound.
It's pretty good. I think there were some things, I don't know whether the questions drove them out, these ballot questions, whether it's a continuation of the high turnout from November.
Good point.
You could talk a lot about what that is, but it did show more engagement this past election.
Yeah. Well, from the business community standpoint, what's the biggest impact the election had? The ballot questions? Yeah, the biggest question would be the ballot questions. I think it's going to force future governors and legislatures to work closer together. These things end, and people think about the pandemic, but keep in mind we've also had an opioid declaration that's been in existence now for years that actually brings additional regulations on top of businesses that this will seek to correct. So we favored this from a number of perspectives, even beyond the most immediate emergency declarations that we've had. Yeah. I mean, the way I looked at this when it gets to the big ballot questions, and I think the first two really drove, having to do with limiting the governor's disaster declaration authority. I don't think there's any doubt that that was a big driver in the turnout, and it did split. Republicans and the business community wanted to open up the economy more quickly than Democrats did, and Governor Wolf, and I'm not getting into whether he's right or wrong. I'm just being descriptive. 90 days, renewed 90 days, renewed 90 days. I'm talking about the disaster declaration.
Correct. Yeah. That was an issue, certainly, and the legislature did not believe that they were involved. They wanted to make sure they were involved. And again, we're to the end point here where in terms of this one, it doesn't mean quite as much, but it's going to, again, force that engagement to bring both branches of government together, both executive and legislative together in the future.
And hopefully they can work out the C word called compromise.
Exactly. Let's hope they can work all this stuff out. Yeah.
All right. The census. Pennsylvania lost, 2.4% in the population. We're about little more than 13 million and change. Yeah. What's a big impact of the census?
Well, the big impact, if you've listened to the media, none of our political pundits here, included in that, but, the talk has been, oh, geez, what does this mean? Who's going to lose a seat? How are we going to redraw? From our perspective, we're much more concerned with this for this reason. We're a stagnated population. It isn't simply the loss of our representation in Washington. It's what got us to this point. What got us to this point is we have policies, laws, things that are set up that actually inhibit investment from coming into Pennsylvania, which means we're not creating the jobs, which means we're not keeping our young people here. It's a reason that we're beginning a major initiative, bringing PA back, that will talk about those things we need to do. We need to focus on what we need to fix in Pennsylvania so we can keep our kids here. I think parents and grandparents are tired of getting on an airplane to fly to Raleigh or to Austin or to Tampa or wherever, which are the states that are adding populations and adding representation. They're tired of going to see their kids and grandkids in those cities. We've got to figure out, with all the assets we have in Pennsylvania, we can and should be doing better. And this should be another wake-up call for us to improve.
Yeah, that's interesting because a lot of the attention has been paid. We lose another congressional seat. We go from 18 to 17. At one point in the 1920s, we had 36. So
exactly.
You can't diminish the importance of that, but I think you're on to the significance of it with the economy.
That's the end result of these decisions. The cause of it is what we have to look at. The cause of our lack of growth, the cause of our stagnation, that's what we have to address here in this Commonwealth.
Yeah. And it takes Republicans and Democrats working together.
Absolutely.
Let's be honest about that.
And it takes engagement of the citizens to say these are the policies that we want.
Look, I want to thank you for coming on.
Sure.
Excellent update. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.